The positivity rate in Delhi has now reached 18%. It is alarmingly high because the WHO standards say that to contain the COVID-19 virus, the positivity rate should be less than 5%. Why is it happening at this point of time? India has also entered a phase where festivities are beginning. I have with me Dr. N.K. Arora, who is the chairman of the working committee group of the National Technical Advisory Group on Immunization in India. So thank you so much for joining us on India Today, sir. What is the reason that a city like Delhi, a city state that's looking at a positivity rate of 18%, do we have new variants that are circulating amongst us that is causing a rise in cases?
Milan, that's a very important question, and sometimes it may cause concern, particularly among certain quarters. So here I would like to clarify two or three things. One is that COVID is very much around us, and we cannot be complacent that since the disease severity is less, so COVID is not there. COVID is very much there. The second is over last 3-4 months, the testing is gone down significantly because the disease is mild. Disease is mild, and therefore the number of tests versus positivity keeps on increasing. So at this time, to look at this 5% is not a great idea. The important point is that the number of people who are requiring hospitalization and the death, what is the situation there? And when we look at it either in Delhi or in other parts of the country, the cases are around 20,000 for last 6 to 8 weeks. But the hospitalization rate, fortunately, have not increased. Severe disease requiring ventilation has not increased. Over 99% beds across the country meant for COVID are vacant and they are available. So overall, at this phase of our pandemic, we should be looking more at severe disease and risk of death. And fortunately, that is not there. Now, the second question you have asked about the infectious nature and the transmission. So this is very clear as the cases are increasing. That means the transmission is quite intense, or there is high transmission of the virus, whichever virus is there. When we look at the data from the national INSACOG data, which is genomic surveillance data, it shows that there are variants which are more infectious as compared to the Omicron standard virus by 20-30%. And this has led to increase in the symptomatic cases. But fortunately, because most of our population is immunized, adult population at least, plus or most of us have also suffered natural COVID infection. So this is called hybrid immunity. It boosts each other. As a result, severe disease is very uncommon. So I would say we should not get panicky, but stick to corona appropriate behavior. That means use of mask, hygiene, and keeping away from crowded places.
So you just mentioned that if we have hybrid immunity, why is that people who have had COVID once, twice, and thrice, and despite having been vaccinated, also are once again getting infected with COVID-19? And do you also think that the recovery is taking longer this time because people are complaining of extreme fatigue and long COVID even after recovery?
So, so there are 2 or 3 questions you have asked. One is the viruses which are circulating. There are 5-6 varieties of viruses. They are all Omicron. There is B4, B5 variety. There is B2, 75, 76, B2, 38. There are all these names are there, which actually the names are not important. The important thing is that some of them have higher transmissibility or higher infection rate. And that is why in crowded places or in some parts of the country, the number of cases have increased or positivity has increased. But none of them is associated with severe disease. So first important point is that there are variants which are a little more infectious, but they are not associated with severe disease. The second is that, and therefore it is imperative and it is essential for all of us that we should remember no complacency. If we let our guards down, suddenly if a new virus comes which causes severe disease, it will be difficult. Now, the second question you have asked that despite 2 doses and some of them 3 doses also, people get two infections, or sometimes I have heard, you're right, third infection have also occurred. Now, right from the beginning, last January 2021, initially it was thought that these vaccines will stop the transmission. It will prevent infection occurring in the population. But over the last 1.5 years, we have realized that all vaccines are very good in protecting recipients with severe disease, hospitalization, and death. But they are not able to prevent the infection. So therefore, I would request and kind of give confidence to our viewers that getting a mild infection with COVID is not something to be worried about, and thinking that the vaccine is not effective. No, vaccine is very much effective. The disease is mild primarily because we are immunized. Disease is not severe because we are immunized. And it is in this context, I will say that all of us should go ahead and get our precaution dose. All those who have completed 6 months, let them get the precaution dose. And from tomorrow, there is another option available, Carbovax, which is a completely made in India vaccine, very good vaccine, and gives a very good boosting response. Either you have received Covishield or you have received Covaxin. So it is the first vaccine which has been now approved as a heterologous booster, which is considered a step forward in our fight with COVID-19. And final question you have asked about the disease recovery and its after effects. So I must say that it is true that some of us, not all, have like a prolonged feeling of unwellness. After 2-3 days of fever and 1 or 2 additional days of cough and sore throat, people recover from symptoms, but they continue to have a feeling of fatigue, sometimes limb pains, and not feeling well. And this usually lasts for a week or 10 days. So people don't have to be very concerned about it. There is no need for medicine. I would say just take good food, and these symptoms recover on their own as the time goes.
So it's a wonderful step that the government has brought in another vaccine, Corbevax, as a precaution dose for the country. What are the options, sir, for a booster dose for those below the age of 18 till 12 years at the moment? Is the government thinking to provide booster through kids as well?
So at the moment, our target, we started in January. So there are not many children who have completed 6 months. And just now we have seen a data just a few hours ago that in children, most of our children have suffered infection first, and now they have got the vaccine. And so they have a long-term immunity available with them. So at the moment, our target is that we should complete primary vaccination dosage in 12 to 18 year group, which is about 15 crore. No, it is about how much? 12 to 18 is, yes, 15 crore people are there. Children
15, are, yes.
Yeah,
yes.
And they should get their both the doses. And I would request parents to go ahead and as soon as possible get the vaccines there.
Right, sir. Lastly, just want to ask you, when do you think we will become endemic with the COVID pandemic? Because are increasing again, and is it the right time to bring back masks as well, sir? Because festivities are just around the corner.
So vaccine, one is COVID is not going to be eradicated. It's going to live. We have to learn to live with it. The important thing is that we need to be careful for another few months and maintain our discipline, because we need to rule out the possibility of emergence of any variant or sublineage which causes severe disease. For last 6 months, we haven't seen any. Let us wait for another few months. And therefore, because all of us do want to return back to our usual economic activities, social activities, and hopefully by the end, based on our surveillance data, it should be possible by the end of this year.
Thank you so much, sir, for speaking to us on India Today. Definitely, as the government has also brought in another vaccine, one should move forward and take their precaution dose, because it is important to be immunized to make sure the severity of COVID-19 does not impact, and the number of deaths that are certainly low at the moment is also because most people are getting vaccinated and some have also built antibodies. But the government clearly bringing forward the message that precaution dose is necessary even as the COVID cases are rising once again across the country. Thank you so much, sir, for joining us.